So hello and thank you for joining us. Today we'll be talking about CalPERS' new Pharmacy Benefits Manager, CVS Caremark. Starting January 1st, 2026, CVS Caremark will replace OptumRx as the pharmacy administrator for certain CalPERS basic and Medicare health plans. I'm Rob Drzamek, Chief of the Health Plan Research and Administration Division here at CalPERS. I'm joined today by Dr. Julia Logan, CalPERS Chief Clinical Director, and David Locke and Mary Hatch from CVS Caremark. Together, we'll introduce you to our new partnership dedicated to ensuring that you, our members, receive the highest quality care for your pharmacy needs. Before we get started, we wanted to share a few housekeeping items. This webinar will be recorded and available on our YouTube channel in roughly a week. For closed captioning, click the stream text link in the YouTube description box. And during the webinar, you may submit your questions by email to this email address on your screen. It is noreply_pbmwebinarquestions@calpers.ca.gov. We will field as many questions as we can after the presentation as time allows. We also ask that you not email any personal information about yourself or ask questions about your specific prescriptions, as we will not be able to answer those specific questions. We will, however, share resources on where you can get your personal questions answered. I'll now turn it over to Dr. Julia Logan to share why we're making this change to CVS Caremark. Julia?
Thanks, Rob. Yeah, I wanted to start with our three objectives for this new Pharmacy Benefits Manager contract, which are affordability, quality and access, and transparency. As a purchaser of healthcare benefits for you, our members, the strongest tool we have available to control costs and improve quality is our contracts with our health plans and our pharmacy benefit manager. As we approached a new pharmacy contract, these three objectives served as our foundation, building on CalPERS' strategic goal of ensuring exceptional healthcare for our members. Specifically, our three main objectives were: 1, foster affordability for CalPERS and our members; 2, ensure access to safe and effective medications; and 3, provide full transparency regarding the terms and arrangements between CalPERS and our pharmacy benefits provider. These objectives reinforce our ongoing commitment to member choice, safety, and prescription drug access. We intentionally built on what had been adopted in our recent contracts for our HMO and PPO plans, which was to align the pharmacy vendor's bottom line with CalPERS' financial and quality goals in providing the best possible care for our members while controlling healthcare costs. After a comprehensive nationwide contracting process, we selected CVS Caremark as our new pharmacy benefits manager for a 5-year contract for 2026 through 2030. Several important factors played into our ultimate recommendation and decision by our board, but foremost, it was you, our members. It was essential that we selected a vendor that would continue to provide you with a high-quality service while ensuring your access to affordable, safe, and effective medication. CVS presented a strong financial offer that featured better overall pricing on drugs and lower pharmacy dispensing fees, all of which ultimately help CalPERS contain overall pharmacy costs for our members. CVS also agreed to performance guarantees that hold them accountable for meeting targets as managing pharmacy cost trends and ensuring clinical quality. They agreed to put $250 million at risk if they don't meet goals for controlling costs and ensuring quality outcomes for our members. We wanted more transparency and insights into the pharmacy benefits manager, and CVS agreed to this increased transparency. Our new contract gives CalPERS far greater protections, audit rights, and other terms that we have had in past pharmacy contracts, including terms that will hold CVS accountable to providing services in the best interests of CalPERS and our members. This contract is a new beginning in our pharmacy benefits program. These terms are groundbreaking, and once again, CalPERS is at the forefront of the market in establishing a new standard of transparency for pharmacy benefit managers industry-wide. Finally, we understand we chose this change on your behalf. You didn't choose it. And it's one of the reasons we're working so hard with CVS to ensure that the transition goes as smoothly as possible. CVS is an established, experienced pharmacy benefits manager with a strong focus on customer care. The implementation plans they've put in place to help members during this transition include mailings, online tools and resources, and a contact center up and ready to assist you starting now. They will talk about this more shortly. With that, Rob, I'll pass it back to you.
All right, great. Thank you, Julia. So here are the basic and Medicare plans that will have pharmacy benefits provided by CVS Caremark starting January 1st, 2026. CVS will cover Anthem Traditional and Anthem Select basic plans and Anthem's Medicare Advantage plan. CVS will also cover HealthNet Salud y Más, both the PERS Gold and PERS Platinum basic and supplemental plans, Sharp's basic plan, United Healthcare's Alliance and Harmony basic plans, and Western Health Advantage's basic plan. We've received questions from members asking if they are moving to CVS, so we want to also share the plans not affected by this change. Plans not affected by this change are Blue Shield's Access Plus and Trio HMOs, Blue Shield's EPO or Exclusive Provider Organization plan, and Blue Shield's Medicare Advantage plan. Also not affected by this change are all of Kaiser Permanente's plans, including their basic plans as well as all of their Medicare plans. Also not affected are Sharp's Medicare Advantage plan and UHC's Medicare Advantage plan. I want to share a few of the highlights on the pharmacy change, which applies to both basic and Medicare members. Pharmacy access remains similar, as most members can continue using their current pharmacy. There will be some formulary changes, and there may be changes to copays. However, the number of members affected by this is low. You will still have access to the safe and effective medications you need. And we have plans in place to ensure a smooth transition for filling prescriptions impacted by a formulary change, as well as an automatic transfer of approved prior authorizations. Now I'm pleased to turn it over to David Locke and Mary Hatch, who will introduce you to CVS and share how they'll be supporting our members, you all, with this transition. David?
Thanks for the introduction, Rob. Appreciate it. We're extremely excited to be here to talk about how we are working to take this transition as smooth as possible for you and your members. Let's start with an introduction of CVS Caremark. Caremark is your pharmacy benefit manager, which means we manage your prescription benefit plan and help keep your medication costs low. As a Caremark member, you have access to a wide range of cost-effective medications and thousands of network pharmacy choices, including home delivery for you and your family. As we go through this presentation, I will be speaking information for basic members. Mary Hatch is also on, and she is the expert on all things Medicare. As we review areas that may differ for Medicare members, I will hand it to Mary to jump in and provide additional insights.
Thanks, Stephen. So the Medicare members are going to be seeing the name SilverScript throughout your materials and in letters and also on your ID card. Essentially, SilverScript is the name of your drug coverage or your drug plan. Very similar to PERS Gold or PERS Platinum, SilverScript is your drug plan name. SilverScript is part of CVS Caremark and manages the Medicare Part D or the Medicare drug program for CVS. So when you see SilverScript, just think CVS Medicare drug plan. That's it.
Great. Now that you know who we are, let's look at what will occur during the transition to CVS Caremark. Our goal during this transition is to make it as smooth as possible for you and to automate as many tasks as possible so that we aren't giving you extra homework. As Rob said, we recognize that this decision was made for you, and it's our job to make it as easy as possible for you. Most members will not need to take any action. Let's start with how you know you are enrolled. We will be handling your enrollment behind the scenes and no action will be needed from you. You will receive a welcome letter in the mail with details on how to connect with CVS Caremark, as well as information on what drugs are covered and what is changing for you, if anything. Additionally, you will receive a health plan ID card containing your new pharmacy information before January 1st, 2026. This ID card will come from your medical carrier just as it does today. But Mary, I think the ID cards will work a little different for Medicare members, right?
That's right, David. So Medicare is slightly different than the basic plans in that you'll have a separate prescription ID, just like you do today. You'll receive your ID along with your welcome kit in early December.
Great. Well, let's look at drug coverage. There is a list of drugs that will be covered, which we call a formulary. Almost everyone will be able to continue using their current medication, but there will be a few changes. So let's take a look at how we will help you with that. If you are impacted by a formulary change, you and your prescriber will receive a mailing approximately 30 to 60 days before the change takes place. This letter will inform you of the change and alternatives that are appropriate for your condition. Always talk to your doctor regarding the change and what is best for your situation. We understand this change may be difficult to complete before January. If for some reason you are unable to complete this before the first of the year, we are here to help you. Simply give us a call and we can update your profile to allow your current medication to be covered until March 31st. Mary, what do Medicare members need to know about drugs that will no longer be covered?
Yeah, so the Medicare member or process is slightly different than the basic member process in that Medicare requires all Medicare members experiencing a change on your formulary are required to get a temporary supply of medication, meaning you don't need to call us to have that temporary supply. Medicare requires for the first 3 months of your new plan, which is between January 1st and March 31st, that you're allowed a temporary supply of any medication not on your new formulary. CalPERS has allotted the Medicare members a 90-day supply, meaning you'll get 3 months of any medication that's coming off formulary. After March 31st, however, your prescriber will need to select an alternative medication or follow the standard exceptions process.
As we have said before, we want to make this as easy as possible for you. In keeping with that, we will automatically transfer your prescriptions in most cases. Let's take a look at what that will look like. For retail pharmacies, you can keep using your current pharmacy. We have 64,000 pharmacies in our network, so chances are that your current pharmacy is also in our network. It does not have to be a CVS pharmacy. If for some reason your current pharmacy is not in network, we will notify you of that change before the first of the year. Mail order and specialty prescriptions will also automatically transfer for basic members. Medicare members utilizing a specialty pharmacy will be receiving a letter with information on your options. Prior authorizations will automatically transfer to CVS Caremark as well. We're in contact with CalPERS and your current PBM to make sure all of this is being transferred automatically so that we can make this change as simple as possible for you. These automatic transfers will not require any action from you. Let's take a look at specialty medications. We understand the complex conditions that these medications treat, and we're happy to help you and here to make that transition smooth and easy. Our specialty team is best in class and will consist of nurses as well as pharmacists to help you understand your medication and side effects you may be experiencing. Our care team is here to help you on this journey and will be in touch with you if you take a specialty medication. All of that will also transfer behind the scenes for you. We mentioned earlier that you can continue using your current retail pharmacy. Let's take a look at that pharmacy network setup. CalPERS members will have access to over 64,000 in-network pharmacies nationwide, including major retail chains and most independent pharmacies. There are over 1,000 CVS locations in California alone, but you do not have to utilize a CVS pharmacy. You can go to any in-network pharmacy. CVS specialty and mail order services are also available. contact customer care, or visit the website to see which pharmacies are in network. We will give you that information about those contacts later on in the presentation. Your maintenance medications, such as those for diabetes, high blood pressure, or asthma, will continue to be available in 90-day supplies via home delivery through Caremark mail order pharmacy. Beginning in January, you will also be able to utilize a retail pharmacy to fill your 90-day supply. CalPERS has heard your concerns on 90-day supplies being required to fill at mail order and has made this change to make them available at your local pharmacy beginning in January. Right, let's take a look at the tools available to you to help make this transition as smooth as possible. Our dedicated customer care representatives are available 24 hours a day, 7 days a week, and are ready to take your calls today. You can see the numbers for basic and Medicare on your screen. You can also visit your CalPERS dedicated website to view helpful information, including your formulary, check drug cost tool, pharmacy locator, and frequently asked questions. Beginning January 1st, you can register on caremark.com and set up your personal profile to track your medications and find personalized information. I'll turn it back to you, Rob.
Hey, great. Thank you, David and Mary. We shared a lot of information today, and we wanted to provide you with what you can expect next. For basic plan members, CVS will be sending letters to those members impacted by a formulary change in November. And in December, all members moving to CVS will receive their CVS Welcome Kit. For basic members, your health plan will be mailing you a new medical ID card with the CVS pharmacy information on it that you'll start using on January 1st. For Medicare members, you'll receive letters from SilverScript if you're impacted by a formulary change. In your Welcome Kit, which will come in December, you'll receive your new CVS pharmacy ID card. For both basic and Medicare members, you can fill any prescriptions you would normally prior to January 1st. And be sure to register on the CVS Caremark website or on their app to easily manage your pharmacy needs if you'd like to do it that way. Finally, I'll remind everyone that the formulary exclusion lists and the formularies themselves are available on our CalPERS website and on CVS's website. CVS's website, as David mentioned, is caremark.com/CalPERS. So now that we've finished with our presentation, we know that you have questions, and we'll get to as many of them in the time that we have left. We have had numerous questions submitted about specific medications. As we mentioned earlier, we cannot answer questions about your specific clinical question at this webinar. However, we will have information on where you can go to receive that. So Julia, can you share where members can go to receive the specific clinical information that they may have, or clinical questions they may have?
Sure. And yeah, very good question. If you have questions about whether your medication is covered, please go look at the CalPERS CVS website and access either the basic or the Medicare formulary to look up your specific medication. The formularies are on there, and so you can look at that. We also have a list of excluded drugs, and you can check to see if your specific medication is on there. You can also call the CVS customer care line or the SilverScript customer care line with specific coverage questions. They're ready to help you. If your medication will no longer be covered on January 1st, there will be either a generic available or an equally safe and effective alternative medication available for you. You'll also be eligible, as Mary and David mentioned, for a transition fill for up to 90 days after January 1st, while you and your doctor decide which medication is best for you. Finally, your doctor can request a medical necessity exception for your medication if it's no longer covered, but you and they believe it's the most effective medication for your condition.
Okay, thank you, Julia. So another set of questions for you. What if a member has several long-term prescriptions with Optum? Who will transfer those prescriptions to a new mail order pharmacy And once I select the pharmacy, which one will it be since Optum is not available? If I have some role in the transfer process, what actions do I need to take?
Sure. So non-controlled prescriptions with refills remaining that are currently filled either with Optum Rx mail and specialty pharmacies will automatically transfer to CVS Caremark. Some prescriptions may require a new prescription from your doctor, like controlled substances or expired refills. CVS will notify you prior to the effective date if action is needed for this. Similarly, if you receive your medication from a retail pharmacy, you'll continue to receive those prescriptions automatically at your preferred retail pharmacy, like CVS, Walgreens, Safeway, and the like, as long as there are refills remaining.
Okay. Next question is, I currently have Optum Rx and they send me 90-day supplies via the mail. Does CVS have this delivery service, and does CVS have a 90-day supply?
Yes, you can continue to receive your maintenance medications in a 90-day supply through CVS mail order pharmacy in the same way and for the same cost as you do through Optum's mail order. You can also receive a 90-day supply of those maintenance medications through a CVS in-network retail pharmacy and also at the same cost.
Great. The next question is, I've noticed that a couple of my prescriptions appear not to be on the formulary. Will these exact medications be transferred over to CVS? And then the other follow-up to this is, my doctor and I have spent months finding medications that I don't have an allergic reaction to, and I don't wish to start all over trying to find things on the new formulary in January. So can you talk about how that might work for this individual or members like this person?
Yeah, sure. These are important questions, so it's good to cover them. If any of your medications are no longer covered because of changes in the formularies, you'll receive a written notification, and your doctor will also be notified. You will also be able to receive a transition fill for up to 90 days after January 1st in order to give you and your doctor time to discuss this and to find an alternative medication. In every case, there will be a generic medication or another safe and effective alternative medication, which you and your doctor can choose. Finally, your doctor can request a medical necessity exception for your medication if it's no longer covered and you both believe it's the most effective medication for your specific condition.
Okay, thank you. So now I have a question for David. So this one is about handling specialty medication. So a member has a specialty medicine that needs refrigeration. Currently, Optum is notified at least 2 business days before the refill is needed, and then sends the delivery directly to our home on the agreed upon day in an insulated container with ice packs. Can you share how CVS handles this situation when it comes to the advance notice as delivery and the shipping of it, please?
We are in contact with our specialty members quite often, and we will follow much of the same process. We will contact you before your medication is due for a refill, and we will make sure that it's still working for you. You can talk with our nurses if there's any troubles there, and we will make sure that you will be home at the time of delivery. If you're not home, or if you need it shipped to a different location or something like that, we will work with you to update that delivery date and address, and we also will be checking the forecast, providing that insulation and those cold packs and anything else that might be needed to control the temperature of that medication.
Great, thank you, David. The next one I think is back to Dr. Logan. So this member has a prescription that needs an annual approval from Optum. My current expiration date is at the end of April 2026. Will CVS honor this approval date? And if it does, who do I need to request a new approval after April 2026? Is that CVS or SilverScript or someone else?
Sure. Yeah. So if you have a current approved prior authorization from Optum Rx that extends into 2026, CVS will honor those approved prior authorizations through their duration of their approval or up to 12 months if the prior auth was approved for a time frame longer than 12 months. Once the PA expires in 2026, then your prescriber will submit a new prior authorization to CVS. If you have any questions about that, because I know it can get kind of complicated, you can call the SilverScript customer care line if you're a Medicare member. If you're a basic member, you can call the CVS customer care line.
Great, thank you. So this question is for CVS. So can you tell us which CVS app or apps to use for iPhone and Android? And are there different options in the two app stores? And also, is there a different option between for a basic member as well as a Medicare member?
Absolutely, yes. You will, the CVS Health app will allow you to see all of your prescription history there. Will allow you to manage your family's prescription as well if you're a caregiver there. So the CVS Health app is going to be your best option there. You are correct. You will see CVS Caremark for mail order, CVS Pharmacy for some of the pharmacy stuff there. We are actually in the middle of a process to combine all those apps into one. So the CVS Health app right now is our work to do that, and will be the best app for you to be able to download there and see that.
The next question, I think I'll take this one. This is about mail order. So opt-in required that a basic member opt out of using their mail order services. Will CVS require an opt-out of mail order? Also, Optum would not allow for a 90-day refill at physical pharmacies. You can only get the 90 days through mail order. Will CVS have the same policy, or will they allow a 90-day prescription to be filled at my local Walgreens? So for this one, as we talked about earlier, starting next year in 2026, basic members will no longer have to opt out of using mail order for maintenance medications. So if you would like to use CVS mail order to continue, CVS mail order and continue the use of mail order, you'll be able to do so, and the cost will be the same. So that is getting a 90-day supply for 2 copays. Additionally, basic members starting in 2026 will now be able to obtain those maintenance medications in a 90-day supply at their retail pharmacy as well. So to answer the question, yes, you can get the 90-day prescription filled at their local pharmacy, and that 90-day supply will cost you 2 copays at your retail pharmacy. Medicare members have always had these options, and nothing is changing for them. So Medicare members can get the 90-day fills at a local pharmacy in person, as well as through mail order. Next question for CVS again. How can we check if our local pharmacy is in network? So how can I check if my local Walgreens is in network? David, would you mind answering that question, please?
Yeah, absolutely. Well, I can tell you first, Walgreens is a network. All the major chains will be, but if you're looking for a local pharmacy, Joe's pharmacy on the corner, and you're like, I'm not sure if this is a network, go to the website, caremark.com/CalPERS, and you'll be able to check on there, plug in your zip code or plug in your address or the name of the pharmacy, and you can see there if that pharmacy is in network for you.
And then another question about home delivery. Will the home delivery service be transferred to CVS, or do I need to register and pay for it? So David, you mind taking that one?
Absolutely. Yes, we are going to transfer any of prescriptions. So if you're currently getting your medication via home delivery, it will transfer over to Caremark for you. You will not need to take any action there. It'll just automatically transfer.
Okay. And then similar question to that. If we have medications through Optum, do we have to change them to CVS, or will it cost more to stay with Optum? And so for this one, many prescriptions will be transferred, as David just mentioned, automatically to CVS Caremark, and they'll go through the same channel they're going through today, whether if it's mail order or if it's picking up at a local pharmacy. Some medications may require a new prescription from your doctor, such as controlled substances or expired refills. So this is again where your doctor will need to prescribe you a new course of treatment if your prescription is ending. You'll be notified prior to the effective date if action is needed. Also, the CalPERS contract with Optum ends at the end of this year, so all of our prescriptions will be moving to CVS for the impacted plans. Another question, this one is about copays. Will the copays be the same as they have been? So for this one, the copays are remaining the same. Like, we're not changing the benefit design at all. However, it is possible that some medications may change the tiers when they're on the new formulary, which could result in a change in copay. So it could go from a tier 1 to tier 2 or tier 2 to tier 1. And so that's where you could see a potential in change in copays. But as far as our benefit structure, the copay amounts are not changing for tiers 1, 2, and 3, or any of our tiers. The next one is, can the new CVS prescription, can CVS help me get the timing of my medications in sync? An example here is I take 4 different medications, 3 of which are 90-day supplies, and one is can only be a 30-day supply. So what can I do to get them all on schedule? So CVS, do you have any tips there on for members who have their medications like out of sync?
Absolutely. We offer a program called Script Sync is what we call it. Just a fun little name there. Essentially, it does what it sounds like. So you can, if you're going to the local pharmacy, you can talk to your pharmacist there and say, hey, can you help me get these prescriptions in sync so I'm getting them all at the same time instead of 3 or 4 different trips in 1 month. Or if you're working them through mail order, you can call our customer care team and say, hey, can you help me get these in sync there? And either way, we can help you out there to make sure that those are lined up for you to make it convenient for you.
Okay, and Dr.
David,
Logan,
can
anything?
I ask you a question about that?
Yes.
Do members need to notify their prescriber, their doctor about those changes, or they can just go through CVS? That sounds wonderful.
Most of the time you can just go through us, but for those medications, they're maintenance medications most of the time that we've got a long-term script on there for, and we can work to change those for you. If for some reason you are out of refills or something like that, there may be a chance that you have to talk to your prescriber, but most of the time the pharmacist even then would be able to do that for you and to fax your prescriber and say, hey, we're making this update to make it easier for your member, and the prescribers are happy to work with us there to make that change.
Great, thank you.
Next question is, how will this transition be handled for those who receive specialty medication through Optum Specialty Pharmacy, since those prescriptions are handled differently than normal prescriptions? Will our specialty prescriptions automatically be transferred to CVS Caremark, or will there need to be extra steps taken by a member who's taking a specialty medication or by their doctors after the changeover? David, you want to talk about that one, please?
Absolutely. So the specialty medications are ones that will automatically transfer with the change. So you want to take action there. We're in contact with Optum, in contact with CalPERS to make sure that all of that is happening behind the scenes. There's an automatic transfer there if you have a current specialty medication. Many specialty medications do require a prior authorization. And so if you have a current prior authorization that extends beyond, is January 1st, if it extends into the new year, then we will transfer that automatically as well. And so all of that will happen behind the scenes for you and be an automatic transfer there.
Okay, great. Next question is, some drugs we are currently taking will require a prior authorization once my husband turns 65. Why is this? And so this really kind of points out one of the differences between the basic and Medicare formularies. So the basic and Medicare formularies in general are very similar. However, some medications that are covered under the basic program, you can do so without prior authorization. And some that once they transition to Medicare, then Medicare requires a prior authorization to be done. However, you should still be able to receive these drugs after your doctor provides the necessary information for the prior authorization. Mary, did you have anything additional to add to that one? Because it's for impact for a Medicare member.
Yeah, I would just add that transition fill comes into play here, so you will have time to work through that with your physician before you need to select another drug or get a prior authorization.
Yep. Okay, thank you. Next question. Under Optum, I was able to get my prescriptions filled at a small local pharmacy, for which I was very grateful. Can I do the same when CVS becomes CalPERS' new pharmacy benefit manager? So David, I think you touched on this answer a little bit before. Want to remind us again how that might work?
Absolutely. Yeah, we're going to cover most independents. Chances are that same small pharmacy is going to be in your network when the change happens over to Caremark as well. The only positive difference that I do want to call out is if it's a 90-day prescription and that pharmacy allows it, you will also be able to get a 90-day fill there as well.
The next question is, under our Optum, my medication is available without a prior authorization for a $50 monthly copay. When CVS takes over as a PBM, will I still be able to get the medication? And will it require a prior authorization? And what will that cost be? Dr. Logan, you mind addressing this one?
Sure. If your medication is covered and it's on the CVS formulary, it will still be available to you. In some cases, a prior authorization may be required when you didn't have one previously under Optum. If your medication is affected by any formulary change, like requiring a new prior authorization or moving to a higher tier, you will be getting a letter. Let's see. You'll be getting a letter with all of that information about that change. Your provider will also be getting a letter about that change, and you can discuss that change with your provider as well. The formulary tiers, the prices are staying the same, so you will pay no more than $50 for a medication if that's at the highest tier.
Okay, great, thank you. Next question we have, who notifies our providers of the transition so that we do not run out of our medication? So David, you want to take that?
Yes, so we will be handling notifications to all prescribers for any medication that will not be covered in the new year. So if you're on the new formulary, if the medication that you're currently taking is a non-covered medication, we will be contacting your prescribers and alerting them that, hey, this medication is going to change, and we'll also be sending you a letter. Now, as we said earlier in the presentation, we understand that there may be some difficulty there. So if you can't get your medication changed over by the first of the year, give us a call and we can allow you to continue filling that for the first 90 days, so through March 31st. And if you're on the Medicare plan, there will be that transition fill that Mary has talked about.
Okay. The next question, I'm not sure exactly who this might go to, might be a little bit of everyone. If a prescribed medication is not covered by CVS or on the approved formulary list, can I still request that medication and pay out of pocket? So how would that one work? Dr. Logan, you want to start?
Yeah, sure. So if it's not covered by CVS, it's not on the approved formulary list. It is still possible. So that you have a few options. The first is that CVS in their letter to you that you will get within 30 to 60 days will have the excluded medication, and it will also have a list of potential replacements, and any replacement will be a safe and effective alternative. There may also be a generic equivalent available to you. If none of those are acceptable and work for your condition, it is possible for you to talk with your provider and get a medical exception request so that that particular drug could be covered.
Great, thank you, Julia. Next question, will I be able to get a transcript of the webinar afterwards or a recording? And where would I be able to access this? So this webinar is being recorded and it will be posted on YouTube. And then once it's posted on YouTube, there will be a link in the description where you can pull up the captions and it will generate a transcript. So once it's posted on YouTube, you'll be able to use YouTube to get a transcript of this, of the entire webinar. Next question is, will an Optum-approved prior authorization granted by Optum after an appeal and submission of clinical information by my doctor, will that prescription, the prescription has also not been on Optum's formulary, nor is it on the CVS Caremark or SilverScript formulary. Will it be automatically transferred to CVS and be honored so the patient can continue to receive that medication? So Julia, that's one that was similar, I think, to the question you just answered of like there's a a prescription for a drug that's off formulary, and they had to go through some hoops, it looks like, to make sure they could still receive it. Can you talk about that one for this one, in case it's different from what you just previously answered?
Yeah, sure. So any Optum approved prior authorizations will be honored by CVS for the duration of the approved authorization or up to 12 months, whichever is shorter. And this is true for excluded medications as well. So I think that was really the crux of that particular member's question. Once the prior authorization has expired, however, you'll have to work with your provider to transition to an equally safe and effective covered medication.
Next question for CVS. Can all of my medications be delivered to me? And if so, how do I sign up for that? So David, can you help answer that question, please?
Absolutely. Many medications will be available via home delivery through our mail order pharmacy. Not all medications, there are some restrictions there, and we're certainly here to help you with that. So if you're taking a current medication and it is available through mail order at Optum, chances are it will also be available through mail order at Caremark. However, our customer care team, you can call them today and they will be able to help you set up that mail order. You will not be able to set up your mail order prescription until January with us. Once that change does occur, we're happy to help you set that up and walk you through, what is allowed, what's not allowed. If you're just curious and you want to know, hey, will it be allowed today? You can use the check drug cost tool and it will oftentimes show you not allowed at mail order if for some reason it is not. And if you've got any questions beyond that, the customer care team is happy to take your call and walk you through that as well.
And another question for CVS. So will the prescription drug cost for the member be the same if they go to a CVS pharmacy, like in person, like walk in and pick it up that way, as well as through mail order with silver scripts? So can you talk about the copay differences, if there is a difference between the in-person picking it up at a CVS pharmacy or in-person pharmacy, and then what they will be paying through mail order? And this is both like a basic and then a Medicare question in case so there's any differences there.
Absolutely. As you said earlier, Rob, there may be different tier changes. So maybe a tier 1 drug, a generic drug today on the Optum formulary is going to be tier 2 with us, or maybe a tier 2 is going to go down to a tier 1. There may be those changes, which may cause a shift in your copays and what you are paying today. However, your copays across the board are staying the same as far as your generic medications will all be within the same copay. Your brand medications will all be within the same copay. Not big differences. It's not going to be a big difference. The differences you may see is where you pay less than the copay. So if a drug today is $2 and you're paying the full price of that drug, that $2, there may be small variables in there where under Optum it was $2 and under us it may be $1.90 or maybe $2.10. And so you may see small variables in that when you're paying less than the copay.
And then Mary, anything to add to that for the Medicare side?
No, the only thing I would add, and this would be apply to both basic and Medicare, is the availability of 90-day prescriptions at retail pharmacies now. Sounds like the members really wanted that, and CalPERS listened and made that change during this changeover.
Great, thank you. And that leads us to the next question. Will we be able to fill 90-day prescriptions at our local CVS pharmacy? Previously, they were only approved through mail order, which was very inconvenient. We could only get 30-day prescriptions at our local pharmacy. So as Mary said, we've talked about it a few times, that yes, with this change, we've heard from our members and are making the change so that basic members will be able to once again get a 90-day supply of maintenance medications at network pharmacies in person. So going to your local pharmacy. You can also get 90-day supply through mail order, but they're not obligated to use mail order for the maintenance medications. This next question, Dr. Logan, this one's for you, I believe. What can be done ahead of time for our medications in your formulary marked ST and PA to ensure these medications are not interrupted in the transition? Can you explain what that question might be asking for those of us who might not know what that means?
Sure. Yeah, all these acronyms. So ST means step therapy. So sometimes CVS will require a member to try one medication first before starting a new medication. And then PA is prior authorization. So sometimes CVS requires more information from your doctor about why you would need a particular medication. So all members who have any new step therapy or prior authorization requirements for any of their medications will receive a letter from CVS 30 to 60 days prior to our effective date of January 1st. Of 2026, and there will be instructions on how to update your prescriptions based on those step therapy or prior authorization requirements.
All right, thank you. Next question, I have a few medications that are on auto refill mail order at Optum. How will this transition work? Will I need all new prescriptions from my doctors, or will CVS request all of that, and will it just be transferred to me? So David, would you mind taking that one, please?
Yeah, absolutely. So the prescriptions will automatically transfer. So we'll get those in mail order and we will start shipping them to you. However, what we will need from you is to opt into your automatic refill. So if you would like to use that automatic refill service, we will just need confirmation that you would like to use that. And then once that occurs, we will reach out to your doctor to request a new script once your current one expires. So we will take it over from there and make sure your doctor is getting that request from us to eliminate that homework on your end.
Okay, thank you. Next question. On average, will copays increase or decrease? This person is on PERS Platinum. They're on PERS Platinum Medicare plan. And so, as I mentioned, copays are not changing. However, some medications may be changing tiers by going from tier 1 to tier 2 or tier 2 to tier 1, like that, which could result in an increase or decrease in the copays for that medication. But our copay structure is not changing. It's just the medication might be on a different tier, higher or lower when it moves over to CVS. And then a couple quick questions then for CVS. CVS, where can we find the list of covered medications?
Absolutely. The caremark.com/CalPERS has that information out there. There's also a list out there that specifically looks at medications that are currently covered that won't be. So you can take a quick look on there and do a search on there to see if your medication is changing at all. And then the covered medications as well are posted out there.
And then this person says, if I was registered with Caremark before, do I need to re-register like as a new CalPERS member? So David and Mary, do you know how that might work if someone registered with Caremark previously?
Rob, I was just looking at that question, and to be honest, I'm not sure of the answer right now. I'm going to need to follow up on that for you.
Okay, but in general, for those members who have not registered already, they'll be able to register after January 1st, 2026, because that's when the CalPERS benefits actually will begin with CVS Caremark. But we'll
Correct,
follow up
yes.
to that re-registering or question if a person already happens to have an account. Okay, the next question, I just started PERS Platinum. I will see a doctor for the first time this month. Can I have my prescriptions filled at CVS, or should I be using some other pharmacy until January? So Dr. Logan, you want to answer that one?
Yeah, so you can, as David mentioned, there are 64,000 in-network pharmacies through CVS. So chances are that the pharmacy that you use when you talk to your new doctor and they will fill some prescriptions for you, the one that you use will probably most likely be in-network. So you can continue to get those prescriptions at the in-network pharmacy after the transition in January. And that transition at the pharmacy on January 1st will be seamless for you.
And then Julia, another question, just similar to what's been asked before, I believe. If medication was already approved via opt-in, will this have to be done again? And will we be notified that this must be done?
Yeah, sure. So I think the person is asking about an approved prior authorization. So if you have an approved prior authorization, that will be honored by CVS for up to 12 months. Or the duration of the prior authorization. So there will be no change to you. At the end of that 12 months, if there is, if you need to get an exception or you need to change your medication, that will be something that you will discuss with your doctor to get that changed.
Okay. Then what if my prescription isn't listed on the formulary or on the exclusion list? So it's just like not there in either spot. What should a member do if that's the situation?
Yeah, so if you don't see your medication on the formulary or on the exclusion list, excuse me, please reach out to the CVS customer care line or SilverScript customer care to ask about that specific medication. If it is excluded, you'll be able to get that 90-day transition fill that we were talking about earlier.
Dr. Logan, another great tool there as well. Obviously, call our customer care team, but the check drug cost tool as well will be able to help you see. So if you put in your medication there and search for it and the cost there, it will show you not covered if it is a non-covered drug.
A good tip. Thank you, David.
And David, where can a member find that?
Yeah, on the caremark.com/CalPERS, that website there will show you the check drug cost tool.
And then another question about the app. So will a member need to register on the CVS Caremark app, or will their information automatically transfer over to the new app?
I believe we're talking about the CVS Health app. What you'll want to make sure is that starting in January 1st, that you are registered on the app, whether that's caremark.com. Caremark.com will be specific to mail order. The CVS Health app will be the best app there, because then you can look at your pharmacy, your prescriptions at retail. You can look at your prescriptions across mail order. So that information there on the CVS Health apps beginning in January will allow you to register.
Okay, great. And then this question, is it possible that some medications may change tiers in the new formulary, which result in changes to co-payments? And where can members obtain additional information about copay pricing? So as I've mentioned, like that could happen where the medication changes tiers, whether it's going a tier higher or a tier lower. And the formularies for the basic and Medicare plans all have the medication tiers in them, and the tier is what determines the copays. So as I've shared before, the copays are not changing, but as you pointed out, that some medications may change the tiers. So to determine if this is happening to you, should check the formulary to determine which tier your medication is on. And again, that formulary is on the website that David just mentioned, the dedicated CalPERS page on Caremark's website. And then a question for CVS. Does CVS accept copay savings cards for specialty medications?
Yes, absolutely. Those will be allowed through CVS Specialty, the retail pharmacy and all that. So you will be able to utilize those.
Okay. And then Julia, another one for you. So can you talk about what does the quantity limits and step therapy mean on the formulary? So I think we had a similar question to this. Can you explain what that means, please?
Sure. So that's will be indicated on the formulary as, I believe, ST and QL. So step therapy means you have to try another medication before that medication that your doctor ordered will be approved. Quantity limits means that only a certain amount of medications per month are approved. That is usually for safety reasons. If your doctor orders 60 tablets of a medication, really maybe only 30 are A, needed, and B, safe. So that's sort of why quantity limits are listed on the formulary. If you do have a medication that now has either step therapy or quantity limits, you will be notified in those letters that we've been talking about 30 to 60 days before January 1st to give you instructions about what to do in the event of that.
This question, could you please say one more time where we can find the list of the covered medications? So the formulary is on CVS Caremark's website. That website is www.caremark.com/CalPERS. And so that's where you'll be able to see the formulary under your health plan and the formulary and the formulary exclusion list and the evidence of coverage and all of the information you need to do your research and to help figure out what's changing for you. This question, CVS question, I tried to look up my pharmacy in the pharmacy locator, but it requires me to register. And when I register with the app, it says it cannot match me to a plan. So can you, CVS, clarify exactly where the pharmacy locator member should be using is at? Is it on the same CVS website that I just mentioned?
Yes, we are actually we're just looking into that ahead of time to try to get an answer for you. We will follow up with that information because we're working to make sure that that is an unauthenticated site for you on the website that Rob just mentioned to make sure that's up there for you. So we will follow up there.
And then question of, can you please explain the tiers that are mentioned? So yes, we're talking about the potential impact of tiers. So CalPERS has 3 medication tiers that determine the copay amounts. The first tier is for mostly generic medications and has a $5 copay. The second tier is mostly preferred brand medications, and that has a $20 copay. And then the third tier is mostly non-preferred brand medications, and that has a $50 copay. And so also realizing that maybe some of the website might be down for some folks, but I know some folks are able to use the CVS website and others are reporting that it's down. So we'll make sure that that is up and running for everyone as we've been talking about, because that is really the resource and the place to go for all the resources that are needed to learn about what's changing with our transition to CVS. So we're at time, and so I'd like to thank you all for joining us. The response to this event has been great, and we're very pleased that we've been able to spend an hour with you today. I'd like to thank our presenters, so Dr. Logan and David and Mary from CVS. The recording for today's webinar will be on our YouTube channel within a week, and we'll also add the frequently asked questions from this event to the CalPERS website by the end of next week. So thank you all again for your watching today. Have a great rest of your day.